Good morning, all. I hope you're feeling well today. My name is James from Molloys Pharmacies, and I'm just giving a little overview here in relation to a question that we had in recently, and I think it's important that we have a little look at it. So here's the question. I'm a 26-year-old with upper stomach problems. I went from a vegan diet to a paleo diet and I had a lot of antibiotics around the same time. It completely destroyed my gut. I have a lot of burping and nausea in my upper stomach all day. I can't eat a lot of food. My upper stomach feels kind of burny and feels like food is stuck up there and not digesting. I've tried PPIs before and they did not heal me. I tried different types of probiotics and they didn't heal me either. What should I do? Well, if we look at that question, the first thing I'd be suggesting to that patient is a little chat with the GP or pop into the pharmacist. The fact that they've tried PPIs before, and those are proton pump inhibitors, and what they do is they stop acid production in the stomach. But the fact that this is ongoing, maybe a little suggestion there of having a chat with the GP would be appropriate. Sometimes when we change our diets, going from a vegan diet to a paleo diet, and the fact that the patient had a lot of antibiotics, that can, number one, it can change how the stomach and the digestive system is working. And on top of that, the antibiotics will kill off a lot of really good bacteria in the gut. And that's why it's important, especially if you take an antibiotic, to make sure you take a probiotic. In my opinion, I think there is a lot of not so good bacteria in the digestive tract, and this has given rise to the burpee and the feelings of nausea. The fact that they're feeling a bit burny and they feel like there's food stuck in their digestive tract and they're feeling a little bit off. Again, it's important here that we get the all clear, and that would mean a conversation with the GP. So on the back of that, if they get the all clear from the GP, we would definitely recommend using I would recommend Benefit's bowel support. Just one sachet a day for about 4 weeks, and what that does is it basically puts prebiotic and probiotic back into the gut. So although the probiotics might be there, might be in the gut, they might not have anything to feed on, and that's why the prebiotics, which more or less a fiber, which is quite effective and acts as a food for the good bacteria in the gut. And if you encompass that with something called Multifiber Plus, and what that does is by adding extra fiber into the gut area, it moves the gut along, or gives rise to something called peristalsis within the gut area. And what that does is it clears out the gut in a safe and positive way. And again, I would be suggesting for about 4 weeks treatment, and we see how things are going then. So if the patient sees an improvement, fantastic. If not, again, it needs a doctor referral. So on that note, I hope this helps people out there with these issues. But remember, if you have symptoms like these that are ongoing, you must see a GP. Thank you, and that's all from James at Molloys Pharmacy.